The anterior forearm. This illustration highlights the palmaris longus muscle. The tendon actually goes outside of the carpal tunnel. 5 muscles attach on the medial epicondyle. The closer that you get to the wrist, there's a large concentration of tendon, which is always more dysfunctional than muscle, does not receive a lot of blood circulation, and when these structures get injured, a lot of times they stay injured. They're more prone to active inflammation as well. Active inflammation may be treated with ice and also gentle cross-fiber friction. With anterior forearm, with the arm resting on the table, there are a few bony landmarks to be aware of. The elbow, which is the olecranon, just medial to that, there's a nib right there called the medial epicondyle. There are 5 muscles that attach there at that medial epicondyle. So you want to be very careful about this area. It might be very sensitive. They might have active inflammation. So if they do, you're better off just icing it and not massaging it very much. The other bony landmarks to be aware of would be just before you get to the carpal tunnel. They're just on the edges of the carpal tunnel right there. So the 2 little bones that stick up right there. And looking at the musculature of the forearm, it's pretty thick in this area, and as you get closer into the wrist, it's mostly all tendon. So with this, we want to be very systematic and work all of the muscles of the forearm, thumb with strips, or fingers, whichever you prefer, knuckles. Go lightly at first, and then you can gradually increase your pressure. It's like 1 layer at a time that you want to work into. Okay, so after you've got this worked pretty well, then concentrate on those tendons, the common flexor tendons just below that medial epicondyle. So you can cross-fiber this area. If this is really sensitive, as I said, you're better off just icing it than actively working it, because that means they have a medial epicondylitis, and you don't want to make it worse. Okay. So after you've got all these structures pretty well worked, the final technique there is called the terminator. The terminator is usually done just 1 time, and this is pretty much just to make sure that all of this fascia and all this fluid is pushed down into the hands. And it helps to smooth all of this area out and through here. So you want to go just below the medial epicondyle. I prefer to use my fingers, but you could use any other tool that you have would be fine. And you go just below the medial epicondyle. I'm going to push straight down into the table. And as I do that, as I slowly go down, encompass as much of the arm as you can. You'll notice just with a little bit of pressure that the fingers will start to close. So what you're doing is you're pushing on the muscle, which is actually kind of pulling on the tendons, which is actually closing the hand. As you get down into the carpal tunnel, go even slower and concentrate your pressure in the center of the tunnel, not on those 2 edges of the bones. Once you get past the wrist, then fan back out to encompass the rest of the hand. And then slowly go all the way to the fingertips, pushing all that blood back in there. So another view of the terminator as the fingers start to close. Just before you get to the wrist, make sure you concentrate your pressure in the center, not on those bone edges. Once you get past the wrist, then fan back out to encompass the rest of the hand. Okay, once you get all that, then maybe a nice gentle stroke back up towards the heart. With wrist decompression, what we're going to be doing is placing our thumbs just before you get to these two bones, and our fingers are going to be underneath like this. And we're going to be pushing down and that way with our thumbs, and we're going to be pushing up and back with our fingers. So that will look like this. So this is where the bones are, so you want to be just behind that. My fingers are resting on the table. I'm going to be pushing down to the table with my thumbs and towards the fingers. I'm going to be pushing up with my fingers on the other side and then back up. So it's like that. This helps to stretch out all of that fascia and helps to decompress the wrist and stretching out the muscles. Kind of a decompression, kind of stretching of the carpal tunnel and the flexor retinaculum. So if these are the bone edges, I'm going to stay on this side of them. So I'm going to be on the proximal side. I'm going to push down with my thumbs and up with my fingers, and I'm going to kind of decompress like that. So I push down with my thumbs, up with my fingers. My thumbs go down distally and my fingers go up and proximal. And it stretches that whole thing out. Sometimes it'll actually pop or click if they're really restricted. Okay.
For more information, go to GaryAtkins.com.